right, today we're going to talk about something incredibly serious and unfortunately all too common, the misdiagnosis of meningitis. We're going to break down exactly why an illness that can start out feeling like the flu can turn into an absolute catastrophe. Let's get right into it.
In the medical world, you'll hear this phrase a lot, especially in the ER. Time is brain, and it perfectly captures the urgency of what we're discussing. See, when you're dealing with the brain and the spinal cord, every single second is critical. A delay isn't just an inconvenience. It can literally be the difference between walking out of the hospital fine and suffering a permanent disability.
And that leads us to the central question, right? How on earth can an illness this dangerous be so frequently missed? The answer, as we're about to see, is all in its disguise.
Okay, so our first section here is called a killer in disguise. You know, in medical circles, meningitis is sometimes referred to as a high-volume giant. What does that mean? It means it's an illness that doctors encounter often, but hiding behind those common symptoms is a giant destructive force.
And this really gets to the heart of the problem. A patient walks in with a fever and a headache. Now, is it the flu, a bad migraine, or is it the opening act of a neurological disaster? Because those symptoms are so incredibly common, doctors have to maintain what's called a high index of suspicion to avoid making a tragic mistake.
Now let's talk about something absolutely critical: speed. Bacterial meningitis isn't some slow-moving infection. The source material calls it a predatory infection, and honestly, that's not an exaggeration. It attacks fast and hard.
Think about that. Less than 24 hours, that is the window we are talking about. A perfectly healthy person, could be an adult, could be a kid, can go from having their very first symptom to being permanently disabled or, even worse, in less than a single day. The clock is always ticking and it's moving incredibly fast.
This timeline just lays out the danger so clearly. At hour 0, maybe it's just a headache. 6 hours later, a doctor might send that person home, saying it's probably just the flu. But just 6 more hours after that, the critical window to treat this with antibiotics can slam shut for good. And by that 24-hour mark, the damage might already be done.
So what's actually going on inside the body? Well, first, the bacteria manage to get past the brain's main line of defense, what's called the blood-brain barrier. Once they're inside, the fluid around the brain becomes the perfect place for them to multiply like crazy. Then, your own immune system launches this huge counterattack, but that very response is what causes the brain to swell, cutting off blood flow and killing brain cells.
So, knowing all of this, the most important question has to be, how can it be spotted? There are very specific signs, we call them red flags, that should immediately turn a simple headache and fever into a potential medical emergency.
Let's really focus in here, because we're not just talking about symptoms. In this context, we're talking about alarms, signals that demand a very specific and immediate response from any healthcare provider. You see, it's really the combination of these symptoms that screams danger. A severe headache that comes on suddenly is a major warning. Nuchal rigidity, that's a stiff neck where you can't touch your chin to your chest. Photophobia isn't just being bothered by bright light, it's painful. Any change in mental status, like confusion or being unusually sleepy, is a huge red flag. And finally, that petechial rash, we'll get to that in a second, but it is an absolutely critical sign.
This comparison chart just makes the difference crystal clear. Look, we've all had the stuff on the left, but look at the severity on the right. It's not just a headache, it's a sudden thunderclap headache. It's not just feeling a little out of it, it's actual confusion. These are the crucial differences that a proper medical evaluation is supposed to find.
Okay, let's zero in on this rash. Petechia are these tiny little red or purple spots that don't go away when you press a glass against them. If you see this kind of rash, especially with a fever, that is a top-tier medical emergency. It often means the infection has gotten into the bloodstream. This combination demands immediate, and I mean immediate, action. Okay, so when these red flags are waving, what is a doctor actually supposed to do? This is where a really important concept called the standard of care comes into play. And it's not a suggestion, it's the rule book.
The standard of care is basically the minimum accepted level of treatment. And in a situation like this, it's not about figuring out exactly what the patient has. It's about immediately ruling out what could kill them. You always have to investigate the most life-threatening possibilities first.
And this protocol shows exactly what that looks like. The moment those red flags are recognized, the steps are clear. You order blood cultures. You perform a lumbar puncture.
You might know it as a spinal tap to check the spinal fluid. And most critically, you start antibiotics right away if you have a high suspicion.
And this right here, this is one of the most common and dangerous mistakes. Given how fast this disease moves, waiting around for lab results to confirm it before you start treatment, that is a gamble with a patient's life. The standard of care says you treat the suspicion aggressively. You start the antibiotics now, and you get the answers later.
This table just lays it all out, right? The common mistakes versus what should have happened. A wait-and-see approach instead of getting those antibiotics started, skipping a spinal tap that was absolutely necessary, or sending a patient home without giving them clear warnings about what red flags mean they need to come right back. Each one of these errors can slam that narrow window for a good outcome shut.
The consequences of getting this wrong, well, they aren't minor. They are profound, they are permanent, and they change life forever for entire families.
You know, the brain damage that happens when meningitis isn't treated in time can lead to a whole range of devastating outcomes. We're talking about severe hearing loss, major cognitive problems with memory and learning, and even paralysis. These aren't things that just heal, they are lifelong changes.
And when a patient is harmed because that established protocol, the standard of care, wasn't followed, well, that has a name. That's the definition of medical negligence. It's about a preventable failure, a failure to follow the established life-saving rules.
And this might be the most crucial takeaway of all. The worst-case scenarios with meningitis aren't just tragic accidents. So often, they're the direct result of a delay, of a failure to act when the signs were there. They are preventable.
So, that leaves us with a final, really difficult question. If the signs are known, if the protocol is clear, and if the stakes are this high, why does this still happen? The fact that these devastating misdiagnoses continue to occur forces us to ask some really tough questions about our healthcare system and about just how important it is for patients and their families to speak up when these red flags appear.